Hello, I would like to present some information about Malnutrition Awareness Week, the Polish view of that week. Of course, malnutrition is a global issue. Based on the Polish studies, we know that 30% of patients who are admitting to the hospitals, they are malnourished, and 70% of them, they will worsen their nutritional status during the hospitalization, and 30% who were properly nutrient on the day of admission, they will develop malnutrition. So based on the scientific data, it is well known that diagnosing of malnutrition, especially early diagnosing of malnutrition and proper nutritional intervention and therapy, they are very sufficient and they are very effective. They reduce the number of complications, they reduce the length of the hospitalization, and they reduce the cost due to the hospitalization. I would like to mention that in Poland, parenteral and enteral nutrition, they are well priced and government is paid for that. So that means that the nutritional therapy is not only sufficient for patients, but also for directors of hospitals and let's say generally for hospitals. Poland is realized that malnutrition, especially consequences of malnutrition, they are not good. And that's the reason why we actively participate in Nutrition Day since 2006. On the meantime, and during that time, we arranged some conferences due to malnutrition topic, and one of the most famous probably that was fight against the malnutrition conference in 2011.
Raising the awareness about malnutrition has always been a very important issue in Poland. And in my opinion, as a former Polspen president, the action that we actually initiated in 2018 and started in 2019, which was the accreditation of hospitals for the good nutritional care, so meaning good screening and good transition from screening to clinical practice, was one of the most important actions we have ever done as a national society. So the idea was to score hospitals for the good quality of care with 15 questions, and if the hospitals scored more than 70% of positive answers, they were awarded a certificate, saying that the certificate was saying that they were actually doing the good quality care in nutrition. And of course, this question were based on malnutrition screening, but also on the use of clinical nutrition in practice. So over these 3 years, we have accredited 60 hospitals. Another 60 failed the accreditation. They are still hoping to get it in the future. And this whole action resulted into huge raising awareness for malnutrition. So there are more and more people asking about how to do things, more and more people trying to complete all the rules. And even with Poland having the mandatory screening for malnutrition, which started in 2012 on admission to the hospital, still things are getting better and better thanks to this new activity.
The Malnutrition Awareness Week, this is a fantastic idea, and that's a great opportunity to present knowledge about nutritional support and the therapy for all medical professionals, doctors, dietitians, nutritionists, and nurses. And on the other side, to patients and people who are interested in malnutrition. Malnutrition Awareness Week started last year, but we promised that we will take part of that Malnutrition Awareness Week this year. The last year we spent a lot of time presenting lectures and the webinars. In our country, we talk a lot about malnutrition and consequences. We also utilized television and radio media. We also share our knowledge with journalists. So some articles, they were published in our country. we try to focus on the malnutrition and the consequences and how nutritional support is important. We also ask patients to share their stories because they explain in a very simple way and understandable way that nutritional therapy saved their lives. So that's what we did last year, but due to the upcoming Malnutrition Awareness Week this year, we have also some plans. In Poland, we noticed that nutritional therapy is primarily handled by surgeons and intensivists. So we would like to change the situation a little bit, and we would like to share our knowledge, especially to other doctors, different specializations, for example, internists, cardiologists, neurologists, oncologists, and primary care doctors. So during that Malnutrition Awareness Week, we, with cooperation with the Polish medical publication house, Medycyna Praktyczna, we decided to present special lectures and webinars and articles, which will be probably published later on, specially dedicated for internists and primary care doctors.